The chair lays out House Bill 4615 and offers a committee substitute and recognizes Chairman Frank to explain his bill.
Oh, there we go. Causing trouble. Thank you very much, Chair Hull, Vice Chair Manuel. It sounds pretty good, doesn't it? And committee members, appreciate the opportunity to lay this bill out. It's a bill that Senator Colcourse and I have been working on for three and a half years, and it's in negotiations. I think we are coming close to landing the plane. I'm going to stay mostly on my notes because I was right there until about 2:30 last night, so I'm not going to wing it as much as normal. Texas is one of the lowest ranked states on the CMS 5-star quality system for nursing homes. Over half the nursing homes in Texas have an overall rating of 1 or 2 stars. In 2024, over 75% of the nursing facilities were ranked with 1 or 2 stars for their staffing levels. There's multiple parts of the rating. This is particularly an issue because studies have shown a strong correlation between staffing levels and quality of care. Additionally, nursing homes are increasingly owned by private equity firms and real estate investors. These ownership types have tended to correspond with lower staffing levels. So the overall purpose of 4615 is to increase accountability for taxpayer dollars that fund the long-term care and increase quality of care. So what the bill does is really 2 things. One, there's an ownership disclosure. It requires disclosure of any affiliated entities with 5% or more stake in the facility. So we should know who owns where your grandma is staying, or maybe where I'm staying soon, or whatever. But anyway, we need to know who owns the different facilities. And the second, and the part that we're still in discussions on, is the patient care expense ratio. It's 85% of Medicaid dollars must be spent on patient care. This includes almost everything related to patient care. It includes nursing staff, dietary needs, housekeeping, and medical services like lab work and physical therapy. There's been a lot of discussions on what gets included, but really anything that helps the patient. HHSC would recoup money given to a facility that doesn't meet this requirements. There are exceptions to this if the nursing home has received a 4-star rating or higher on 2 or more of the listed CMS 5-star quality rating categories. That way, if they're doing it regardless of how they spend money and they're doing great on their tests, then that's great. Second, if the expenses are acquired due to a disaster recognized by a governor's declaration, or if the nursing facility has an average occupancy rate lower than 75%, in which case they are subject to only a 70% patient care expense ratio. When they have a lower occupancy expense, it's much harder to hit those numbers. Almost finished. The bill also requires HHSC to submit a report to the legislature on the patient care expense ratio and publish a list of facilities whose funding was recouped. Importantly, it repeals the nursing facility direct care staff rate enhancement program. So anyway, with that, I'd be happy to answer any more questions. We do have a resource witness to ask some of the detailed questions. It is a big bill because it affects the money directly. And it's kind of nice to be dealing with Senator Colcourse because she has vision on both sides of that issue, the policy side and the money side. And so it's something that is important. It's trying to focus on making sure the money is actually spent where it needs to be. If they actually do well, despite how the money is, then they don't have to do that. But anyway, with that, I'd be happy to answer any questions.
Thank you, members. Representative DeRazio.
Yeah, thank you for bringing this legislation for Representative Frank. When I look at the 85% of the Medicaid to patient care, how did you come up with 85%?
It was looking at different, it's been a long negotiated iterative process, and really we have moved it based on what gets included in there. Right now that number's gotten a lot higher because we've included almost everything related to patient care. Because if you say, we had I'm trying to remember back a couple years ago, we had a lot lower number when it was like just staffing. Now we've put almost anything that could possibly be considered nursing care in there, and so the number has been pushed up. So it's been really a negotiated, and then looking at, we've literally looked at the financial statement of different companies that are doing a good job, and this is kind of where we've ended up. I think there is still some discussion, some people wanting to go down to 80%. I think you may hear testimony to that end. They probably like to go down to 50%, but it's really feeling like here's what they can do, here's what some of the best in the state do.
In your work on this, Of the, and you might not be able to answer this question, but give it a good try. How much of the cost is indirect overhead?
Well,
I mean,
how much of the
that
cost
might
of
be
a,
tough
of a
to
nursing
answer.
home? Well, because
Yeah.
every nursing home is different. I mean, I'm a financial geek. I'm a finance guy by nature. In business, I do acquisitions. Cost accounting is different for every single company because you can almost, it's the old joke, what is 2 + 2? What do you want it to be?
Yeah.
Tell me what you want it to be. So cost accounting, and really it is very complex. I initially got told, well, we don't make any money on these nursing homes. And so I asked them to bring me a financial statement, like literally a financial statement, and they didn't have to, but they did. And I looked, I said, well, what's the $97,000 a month lease payment that you're making? And it was to a related company, right? And so that's fine, but that's why they, quote, didn't make any money, is because they were paying themselves almost $100,000 a month. And I don't begrudge that. I just want to know it, right? Like most of the patients, around 60% of the patients for Medicaid patients, it's a huge amount of money that we're spending, and we should, we should make sure that it's going here and not to, Boca Raton.
Yeah, that's right. Well, I appreciate that. Thank you.
Thank you.
Members, other questions?
Wait. Oh, I'm sorry. Go ahead. Oh, wait. I didn't know how to turn that mic on. Ooh.
So no other questions, members? Okay,
All right,
we
thank you.
will
Would
reserve your
respectfully-
right to close.
Thank you.
And Travis Clardy, Texas Healthcare Association, against the bill. Is that correct?
That's correct, Madam Chairman.
Thank you.
Thank you for the opportunity to testify. And yes, that's the Texas Healthcare Association, not the Boca Raton Healthcare Association. And while I appreciate some of the thoughts behind this bill, we are opposed to the legislation. And fundamentally, in the state of Texas, we're not in the business of picking winners and losers or of micromanaging businesses. And that's what this bill attempts to do. It's the same thing that the Biden administration attempted to do with the staffing mandate at the federal level, which we were thankfully successfully able to defeat with the help of General Paxton in federal court in Amarillo. This is the same thing, different verse. And it's, again, we are a regulated industry and should be, need to be. We want to make sure the elderly, the frail population of Texas is taken care of. But nowhere else in Texas government where we have funds go to other vendors. We don't go to a vendor that provides the IT that I tried to register on today and tell them how they should spend that money, how they should allocate between payroll or expenses or other overhead. We don't do it for hospitals. We don't do it anywhere else in the budget. But for some reason, there's an attempt to push this rather onerous, and as my good friend and classmate, Representative Frank said, it's a 2 + 2 is whatever you want it to mean. But the point, as Jerry says, these are all different facilities. And one of the hardest things you have to do in your job as a legislator is these one-size-fits-all programs or policies don't work in Texas. We're a very diverse state. Facilities are different to each other. And the best people to make the decisions on how to spend the money that's allocated to them under these programs are the operators, the owners, the administrators, boots on the ground that know that facility. There are very different, radical different costs of expenses for payroll depending where in the state that you are. That's the decisions that we can make. So again, there's things in here, and I'm not stalking Representative Frank when we finish the bill today, but I'm going to be following him out. We got this committee sub last night. The bill is originally filed, had a whole lot of problems. I do appreciate the work that the folks at this table and Chairman Colcourse has done in the Senate, and I appreciate the invitation 3 weeks or so ago to come meet and talk about. But there's still some items I don't want to go through because it is a lot more than you want to hear of where this bill could be corrected. But at the end of the day, the staffing mandate is not necessary. It's not required. In fact, I think it's onerous, and it starts us down a dangerous road where the government begins to have more and more control over private businesses and instructing them what they can and cannot do. I think we should stay true to our roots in Texas and be a pro-business environment. And for those reasons and more, I oppose this bill, but I'm happy to answer any questions specifically about the legislation.
Members, any questions? No. Thank you all